Anencephaly is a serious birth defect where parts of the brain and skull are underdeveloped or missing. It is classified as a neural tube defect caused when the upper part of the neural tube does not close completely during early development. Babies with anencephaly are usually born without the forebrain and the cerebrum, the parts of the brain responsible for thinking, hearing, and vision. The remaining brain tissue is often exposed as the skull does not fully form. There are three types of anencephaly: meroanencephaly, where there is partial formation of the cranium; holoanencephaly, where the brain is completely absent; and lastly, craniorachis, a condition where the brain, skull, and spinal cord fail to develop properly.
During the first few weeks of embryonic development, a structure called the neural tube typically closes. The neural tube eventually becomes parts of the skull, brain, and the spinal cord in the developing baby and in the future adult, and thus the normal development of a baby's head and brain occurs. In anencephaly, however, the anterior end of the neural tube fails to close. This is the end that forms the brain and parts of the skull. Because it does not close, it causes exposure of the baby's brain and spinal cord to amniotic fluid, which is the fluid that surrounds the developing embryo. This exposure causes brain and nervous degeneration and thus causes anencephaly and all of the symptoms that comes with it.
Anencephaly is a rare and devastating neural tube defect, but on a brighter note, it occurs infrequently on a global scale. Statistically, only 5 in 10,000 newborns worldwide are affected. In the Philippines, the condition appears to be even rarer. According to a study conducted in the Philippine General Hospital, its prevalence is estimated to be just 7 in every 1 million admissions, which is a significantly lower rate than the global average. However, despite its rarity, anencephaly is a condition with severe outcomes. It's important to understand what this diagnosis entails. Babies with anencephaly have underdeveloped brains and skulls, which leaves them unable to perform critical life-sustaining functions. Tragically, this results to a mortality rate of 100% within just the first year of life. The survival statistics highlight how fragile these infants are. Studies show that only about 40% of babies born with anencephaly survive the first 24 hours. And this number drops drastically as time passes, only 2% make it beyond the first week. To put this into perspective, the longest living baby diagnosed with anencephaly survived for just 28 months, which is just over 2 years. This grim picture emphasizes the critical need for awareness, early detection, and research. Preventive measures such as adequate folic acid intake during pregnancy played a key role in significantly reducing the risk of anencephaly in several countries such as the US. By understanding the condition and addressing its root causes, we can continue working toward a future with fewer instances of this heartbreaking disorder.
Anencephaly is diagnosed both before giving birth and after giving birth. Before giving birth, the primary method of diagnosing anencephaly is through ultrasound, a diagnostic imaging technique that uses high-frequency sound waves to create images of blood vessels, tissues, and organs. Using ultrasound, anencephaly is diagnosed by demonstrating the absence of the cranial vault or calvaria, which is the cranial space that encases and protects the brain together with the base of the skull. It should be noted that it is advised to test for anencephaly using ultrasound during the second trimester of pregnancy, where the brain is said to be sufficiently developed enough to complete the diagnosis and rule out any other potential conditions. In addition, ultrasound can also detect a condition called polyhydramnios, or the presence of excess fluid in the amniotic sac, which is also associated with anencephaly. Another way of diagnosing anencephaly before giving birth is through amniocentesis, which is the aspiration of amniotic fluid from the amniotic cavity. This method is conducted to gauge the levels of a protein produced by the liver and yolk sac of the fetus called the alpha fetoprotein or AFP. AFP has no normal function in adults, but it is associated with anencephaly in high concentrations. Lastly, after giving birth, a baby can be diagnosed with anencephaly if it meets the following criteria, namely the absence of the calvarium and scalp, external presence of a hemorrhagic or fibrotic mass, and the absence of cerebral hemispheres.
So, how does this affect the development of the child? Unfortunately, there is no treatment or cure for a child with anencephaly, and the child dies within a few hours or days. Their characteristics include 1. Absence of bony covering o yung matigas na covering over the back of the head. 2. Missing bones o mga nawawalang buto around the front and sides of the head. 3. Folding of the ears. 4. Cleft palate o sa Tagalog tinatawag nating bingot o ngongo. Ito yung condition na yung roof sa bibig ng bata hindi siya completely naka-close, which leaves an opening that extends into the nasal cavity. 5. The child may also develop congenital heart defects, meaning may problems sa structure ng puso ng bata. And lastly, they may still have some basic reflexes, meaning meron pa rin silang mga involuntary responses. But without the cerebrum, they don't have consciousness and the baby cannot survive.